Hi, welcome to Medhealthfit, the show that integrates healthcare and wellness. I'm Eric Dirac. Welcome to the show. And this episode is part of our ongoing series in cancer wellness care. The last episode, we really talked about what is cancer. We talked about some of the forms of cancer, the staging of cancer, etc. This episode, what I'd like to get into are the following elements of cancer care. This segment, we want to talk about lab tests, why these tests are important, why you should have lab tests for prevention, and just knowing aspects about cancer care. The other thing that I want to talk a little bit about in this episode is cancer survivorship rates, which is survivorship is a very important topic in cancer care and treatment anyway. So I want to give a little bit of information about survivorship rates and sort of what are some of the baseline numbers on that. In the last part of the segment of the show I want to talk about is complementary and integrative medicine, which has always been an important part of cancer treatment and survivorship. But over the last couple decades, it's gotten a lot more press. And I think that a lot of people in traditional sort of mainstream oncology care are giving a little bit more credit to complementary medicine, A, because of the vast number of people who are engaging in it personally, and B, some of the interesting studies that have come about in the last 10, 15 years about complementary medicine. So let's get started. One of the first things that I've talked about with people is the integration of certain types of non-mainstream exercise in cancer care. Some of the current events that I always like to give presentation are two things, yoga and Pilates. Now, most people have heard of both yoga and Pilates, and most people do yoga, but they do it to stretch their muscles, they do it to strengthen themselves up. They wouldn't think twice about engaging in yoga or Pilates exercises and its effects on either cancer prevention or knowing someone who's a cancer patient who's actually doing it as part of their survivorship program. Very important. Over the last 5 years, there has been a number of research studies in yoga and Pilates and how well they do for people who have cancer. There's another very interesting element of what I'll call movement therapy called NIA training. And we actually are fortunate here in Santa Barbara to have Ken Gilbert, who I know has been on Santa Barbara cable show many times with many of the endeavors that he does. He is a leading international NIA instructor. He travels the world, and NIA training has actually shown tremendous benefits in terms of people who practice it for cancer survivorship. So much so that the MD Anderson Cancer Center in Houston, Texas, actually has a NIA exercise program for their cancer recovery. So patients can actually go to the center during and after their treatments, and they can engage in NIA training. So it's being taught in many places across the United States, even some of the top cancer centers. Well, let's look at some other current events that I think are of interest to people in terms of cancer care. And you can see on this slide that we've got some stalks of celery. I know that some people love celery. I know some people are not crazy about it. But I'm going to tell you a little bit about celery that you might not know. University of Missouri researchers found recently a compound called apigenin, which is found in celery, which works in conjunction with your body's own physiology to reduce cancer tumors. Actually, its effects are 9 times greater than most chemotherapy agents. And it works on some of the deadly fast-growing aromatase breast tumors by inhibiting the proliferation or the growth of these tumors and reducing the expression of the gene which is associated with the cancer's own malignancy. So this apigenin compound in something as simple and as tasty as celery may be one of the more powerful anti-cancer and anti-breast cancer methods that we have. Apigenin is a natural compound. It's found in other types of vegetables, but it's very high concentrations in celery. So another good reason for your mom to tell you eat your vegetables is that it may reduce many types of cancer, but also has a very powerful effect on breast cancer prevention. So I mentioned at the beginning of the show we're going to talk about laboratory tests. And most of these things are simple blood tests and why they're important. every year you should go to your doctor and you should get a blood test. And if you're concerned about cancer prevention, or if you've been diagnosed with cancer, you're going to want to know what your blood levels are, your white blood cell count, your immune cells, etc. Your immune cells help you fight cancer, so they're important for cancer prevention. But for the most part, you want to look at all kinds of cells, mostly your white blood cells, because those are the cells that when you have high levels of inflammation in the body, your white cells go up. And they're usually very high if you've been diagnosed with cancer. So in terms of prevention, blood tests are very important once a year. You need to know what your red cells are, your total cholesterol, what they call a CBC, a complete blood count. You need to know what those numbers are every year, and your doctor is more than happy to go through those results with you. But secondly, in terms of the immune cells, you'd like to know in terms of cancer prevention how those cells are doing. And if you're diagnosed with cancer and you're undergoing specific treatments, those immune cell levels are going to change dramatically during the course of your treatment. So the lab tests are extremely important, either on a weekly, bi-weekly, or monthly basis, to know where not just your white blood cell count levels are, but your entire immune system. So let's look at some of these immune system cells. The natural killer cell is one of the prime immune system panels, along with macrophages, etc. They're the ones that really are up there in terms of fighting cancer tumors at their smallest levels. The white blood cell count, which most people know, you've got red cells and white cells, are a major indicator of immune cell function. And usually the numbers are under 3,000 cells per cubic millimeter. And again, if you're diagnosed with cancer, there may be at 300,000 cells per cubic millimeter, so they really go up. Your blood platelet is a clotting mechanism, and these cells are usually around 50,000 cells per cubic millimeter. They're very helpful just in the whole, just general, immune process and clotting process as well. Another lab test that you may hear about from your doctor is your BUN, or your blood urea nitrogen, and that really helps you with your, understand your kidney function, which is linked to your overall hydration status. If your BUN levels are abnormal, that means you may have some aspects of your kidney that aren't functioning well, and then you can discuss those with your doctor. And then lastly, your hemoglobin counts. And if your hemoglobin levels are very low, chances are you're very fatigued. You might have, pale color in the skin. You might get dizzy very often. So you're going to have to talk about your doctor. Well, what kind of food should I eat? What kind of vitamins should I take? What other, what medications might I need in terms of keeping those hemoglobin levels at a normal level? But if you don't know any of these blood levels and you're having problems with general fatigue, or you're having other types of body issues, getting a blood test on a regular basis is the best way to know how all the internal organs are really functioning well. So I'm a big, strong advocate of lab tests, both for prevention of disease, knowing what everything is. Your fasting blood sugars, your insulin levels, your hormone panels, your immune system. If those things are all in the normal range, chances are you're doing very well. But if you don't get a blood test, you'll never know. Well, how often should you get a blood test? Most people get one about once a year. As you get older, your doctor may recommend that you get one twice a year because things may change at a little more rapid rate. But what other things are you looking for when you get a blood test other than cancer prevention? Well, if you get cholesterol in your lipid profile, you're looking for cardiovascular disease risks. High levels of cholesterol, high levels of blood fat, those are pretty good indicators of cardiovascular issues. The other thing that you might want to look at are hormone levels. And in terms of cancer and aging-related diseases, high levels of certain hormones, estrogens, progesterones, testosterone, etc., in the blood system are good indicators that you might have a higher risk for certain types of diseases. And we know that high levels of estrogen are themselves precursors to certain types of hormone-related cancers like breast cancer, etc. So knowing your hormone levels is very important. Knowing your cardiovascular risk factor is very important. And again, you'll never know what your body's doing internally if you don't have the blood test. Well, let's talk a little bit about hormones in general while we're on the topic. Estrogen-specific hormones are linked to breast cancer, cervical and uterine cancer. So high levels of estrogens may actually cause an increased risk for those types of cancers. And I'm going to skip to the male hormone, the testosterone, which in very high levels may actually reduce the risk for certain types of male cancers, prostate cancer, testicular cancer, etc. And I'm going to go back to the middle here and talk about stress hormones like insulin and cortisol. Those hormones at very high levels over time also increase your risk for most types of cancers because they're just floating around the bloodstream. And hormones in general, if you have very high levels in the blood, can increase your risk for many different types of disease. And the last thing that I have on that slide is what does exercise have to do with the hormones? Well, exercise is a huge modulator of these hormones, and I'm going to talk about testosterone specifically. In men, if you're exercising, if you're lifting weights, if you're doing something vigorous on an almost daily basis, you're going to be using that molecule of testosterone in the system to repair your muscles and to help you with all of the repair of those tissues. It's not going to be floating around the bloodstream at high levels causing havoc within the bloodstream and other types of internal organs. It's going to be used for its major function, which is the repair of tissues. It's the same with estrogens. You're going to be using those estrogens in terms of exercise for their specific functions with their tissues, and they won't be floating around the bloodstream as well. It's the same with insulin. If insulin is being used to help glucose get into the cell, it's not floating around the system causing damage. So in terms of the power of exercise with hormones in general, that's a very, very good reason in terms of maintaining a regular exercise program is to make sure that those hormones are in check. Well, I said at the beginning of the show that I wanted to talk about cancer survivorship rates. And I'm going to make a comparison with Caucasians and African Americans in terms of 5-year survivorship rates. Now, the American Cancer Society looks at if a person is alive and doing well and thriving at 5 years, their odds of surviving longer are much greater. So I want to look at the top line there that looks at all sites, all different types of cancer. And at 5 years, 68% of white persons, 58% of black persons are still alive and doing well. If we look at women with breast cancer, at 5 years, 91% of whites, 78% of blacks are still doing well. Colon cancer, 66 and 55. Leukemia, 52-42. Prostate cancer in men is very interesting in that almost everybody who's diagnosed with prostate cancer is still alive and doing well at 5 years out. Non-Hodgkin's, 66-58, and uterine and cervical cancer, 74 and 65. So if you take an average of all of the above cancers, excluding the all sites, it's about 74% of white persons and 64% of black persons are still alive and doing reasonably well at 5 years out. My goal for this segment, this whole series on cancer wellness, is to say, how can we use exercise and wellness attributes to keep people alive at 10 years out, 15 years out, and still doing as well or better than even before they were diagnosed with cancer? So survivorship rates, when we look at 5 years is according to the American Cancer Society. I want to look out a little bit farther and say, how can the statistics be changed by virtue of applying a wellness compound like exercise or changing diet, adding relaxation to the mix? How can those elements actually improve survivorship? So that's going to be part of our ongoing series. We'll be talking about that in the next segment, a little bit more about exercise and survivorship rates. So the next topic that I wanted to talk about was complementary medicine. It's been actually a part of cancer treatment for over 100 years, but most people don't know that too much about it. So I'm going to try to define complementary and alternative medicine from the standpoint of what most people think alternative medicine is mainly people taking herbs and shaking beads and doing some chakra or something like that may not be very efficacious in terms of how well people feel. But the term complementary medicine has a little bit different connotation in that it is usually used in conjunction with a traditional oncology chemotherapy regime, hormone therapy regime, any other type of doctor-prescribed program that you're going through. You might do a complementary medicine program in addition to that. And that complementary program may be yoga, it may be meditation, it may be a combination of those. It may be a specific type of diet. It may be a specific type of vitamin supplement, or a combination of exercise and vitamin supplements, or a combination of exercise, relaxation, and nutrition. We'll put all those things into the pot of soup and we'll mix them up and we'll say, what's the best type of program for a person to use in terms of the type and staging of cancer that they've been diagnosed with? What's going to give them the best odds of successful recovery and survivorship? So how do you talk with your physician about a complementary medicine program? Well, there are some doctors who are in favor of complementary medicine. There are some doctors who really don't care too much about it. So in terms of doing it, I would say that does this program that I'm engaging in, is there going to be any problem with the medical regime that I'm on? And I'll give you an example. There are some types of vitamins that may have a poor interaction with chemotherapy. You talk about that with your physician, you may be able to steer away from those types of vitamins until after the chemotherapy regime is over. If you're undergoing a type of strength training program and you're going to have surgery for your cancer, you might want to reevaluate not doing the program until after you've gone through your physical therapy. And the other question you might want to ask yourself is, are you doing some sort of complementary program now? Are you already taking a yoga class? Do you already meditate? Are you already taking vitamins? Well, if you are, and you've been diagnosed with cancer, let your doctor know. I would hope that they would work with you in terms of integrating those two methods together to increase your odds of survivorship. And I know here in Santa Barbara, we've got a number of different programs. We've got exercise program at one of our local health clubs, our YMCA. Our local cancer center actually has a wellness department. So they have many methods that newly diagnosed cancer patients can learn and actually practice different types of complementary medicine in addition to their regular cancer treatment. So let's look at a couple types of interesting complementary medicine programs and how they might actually be used. The first is prayer and meditation. And I'm going to lump those together because even a person who is not very religious can engage in meditation for the benefit of their health. And it's actually the most applied complementary medicine program. It's used by over 60% of cancer patients worldwide. The second type of complementary medical program is dietary factors. And diet, according to the National Cancer Institute, may actually account for almost 70% of cancers. So if you make some dramatic changes in your dietary program, you may actually make a big swing in both the detection of cancer, the spread of cancer, and the survivorship from cancer. The next element here is group support. And most people say, well, support groups, I've heard about those for, many different types of things. Well, support groups have really gained a lot of exposure over the last maybe 20 years due to groups like the Wellness Community, which started in Los Angeles, California, Cancer Treatment Centers of America, and also Gilda's group. Gilda Radner, the actress from Saturday Night Live, was very much in favor of doing group support when she was diagnosed and treated with her cancer. And then some of the more famous, I'll say, alternative medicine programs over the last 50, 60 years. The gentleman on the left there is Max Gerson, and back in the 1930s and 40s, he developed a series of complementary medical treatments that had very high effectiveness rates for treating cancers. And of course, he fell out of favor with the medical societies back in the 60s and 70s. But over the last 10 or 20 years, the Gerson method has actually gained a lot more popularity. There are many medical clinics in the East Coast, here on the West Coast, that actually practice the Gerson method in addition to their traditional medical treatments. We have other methods. Here in Santa Barbara, we have the ESSIAC treatment right on State Street. The use of the Hoxsey method, the Brzezinski method, all kinds of treatments that have been used that, again, some doctors are not in favor with, but they're gaining a little bit more momentum in terms of how well that they are being used. Laetrile is actually an extract from apricot seeds. And research in the 1970s, actually in Sloan Kettering in New York City, found some interesting positive results with some animal studies, but it still is not really highly regarded by most doctors, most oncology circles. Supplements, we did talk about vitamin D, the antioxidants, the omega-3, high levels of vitamin C have all been used in terms of anti-cancer treatments. The Gerson method uses vegetables and juice drinks to detoxify the liver, and it actually is used with daily coffee enemas, which is supposed to change some of the molecular structure within the colon, which again is supposed to help in terms of cancer treatments. The ESSIAC method is a tea that's derived from the sheep sorrel plant, and it tries to aid in the normalization of pancreatic enzymes. And another interesting program that's been used for the last 10 or so years is sodium bicarbonate, which is baking soda. There are a group of doctors that believe that certain types of cancers are a fungus and they're very highly acidic, and if you can use an alkaline solution like sodium bicarbonate to irrigate like lung tissue or internal organ tissue, you may do very well in terms of reducing the cancer tumor. It's been successful in certain areas. I think there's a lot more research that needs to be done on that particular area, but nonetheless, all of the alternative treatments that I've discussed here are gaining in popularity. And I think part of the reason is that through the internet and through just travel, word of mouth, that people are learning that these things in certain instances do have some level of efficacy. They do enhance the treatment process. We spoke about, I think this is probably the third episode that I've mentioned something about vitamin D. And the reason is the sun can actually protect you against skin cancer. It can actually protect you against almost all types of cancer. Vitamin D is also, the deficiency is connected with Parkinson's disease and multiple sclerosis and other types of diseases. But one thing I'm going to mention in terms of today's episode, a health claim was filed with the FDA here recently, about a year or two ago, that stated that vitamin D could actually be used in terms of qualified health claims in writings and on food labels as such, as long as the claims were not misleading. So vitamin D is really the first sort of natural substance which has actually obtained FDA approval to be used as a health claim in terms of cancer care. I think that's fantastic. I think in the last 10 years, the amount of positive research in vitamin D for a number of different medical issues has really shown us that it's a very powerful natural treatment tool and should be used by everyone. And like I say, if you live in a part of the country where you can get some sun, 30 minutes to 45 minutes a day is very, very helpful in terms of increasing the amount of vitamin D. Well, I'm going to introduce you to a gentleman right now named Dr. Stanislaw Brzezinski. He practices in Houston, Texas. He came to the United States in the late 1970s from Poland. And when he came to the US, he opened a clinic in Texas and he started treating head and specifically brain tumors. And the specialty that Dr. Brzezinski had was a substance called anti-neoplasms. And to make a long story short, he patented this method. He treated thousands of patients successfully and was in a 25-year fight with the Food and Drug Administration about his treatment. And I believe that in 2005, he won a Supreme Court decision stating that, yes, indeed, that his treatment was successful and efficacious and that he could continue treating patients all over the United States. So I look at Dr. Brzezinski as really one of the pioneers in complementary medicine treatments in the United States. He's done a fantastic job. He's produced many, many scientific studies. He's actually one of my complementary medicine heroes because I've been so enamored with his work over the past 20 years. So I want to look at another study here. This was published in the Alternative Therapies Journal back in 1999. And some people say, well, that's kind of an old study. But certain studies are good, they're useful, and they need to be sort of repeated over time. This study looked at 112 breast cancer patients who practiced complementary medicine and in two different areas. Part of the survey asked them what complementary services were you interested in trying. Well, 85% said prayer, 76% said that they were interested in exercise, over 48% said they were interested in just general healing, spiritual healing, other types of healing for the body, and about the same number said they were interested in the vitamins and how they may help their cancer. Well, most of these people had an interest in complementary medicine because a lot of people were still interested in doing it because some of them already were. 76% of the women who in their experimental study survey said that they were already doing prayer versus 25% of their non-cancer control ladies. 38% of these breast cancer patients were already engaging in exercise versus 26% of their controls. 29% were already doing healing processes versus only 4% of the controls. And over 25% of the breast cancer ladies were already taking vitamins versus only 2% of the control group. So I thought it was very interesting that there was a big interest in complementary medicine for people who were actually engaged in it, as well as folks who wanted to learn more about it. So I felt that prayer and exercise, or meditation and exercise, are two of the more fundamental areas of complementary medicine, even more so than spirituality or spiritual healing, and even vitamins, which is very interesting. So it's important to talk with your doctor about complementary medicine. It's an interesting area. There might be some tremendous benefits in terms of doing certain types of complementary medicine, like vitamins. Some things may not be that good, but they may cost a lot of money. So in terms of what's good, what's best for you, share it with your doctor and let them know that you have an interest in this and that you want this to work for you. And the last thing that I'm going to talk about here in the last minute or so that we have is exercise as the best type of complementary medicine. And I'll finish by saying this, and we're going to talk about this in future episodes. Exercise enhances blood flow. Exercise modulates hormones. We've already discussed that a little bit in this show. Exercise increases circulation and what's called collateral circulation. You actually grow new vessels by virtue of exercising. And lastly, exercise improves the immune system and your lymphatic flow. And we'll talk about that in a future episode too. But in terms of the whole complementary aspect of exercise, we're going to really start discussing in the next few episodes why exercise may be the most important type of complementary medicine and how you can incorporate that into your overall strategy for both A, cancer prevention, and B, if you've been diagnosed, how you can enhance your therapy process. I'm Eric Durack. This is this episode of MedHealthFit. Thanks for watching.